All right. So when I went to the clinic today, the what we actually discussed the most in the clinic today was a preterm baby. So they were more of like trying to talk about complications. So one of the issues that could actually come up in a preterm baby, like a preterm baby, you have complications system by system, right? So if we're talking about the lungs, of course, we're talking about the respiratory system. So there are issues that could actually come up in the respiratory system in a baby that is not ready to come out yet. Baby that is not up to, I think they said 37 weeks, right? So problems of fetal lungs not maturing quickly. So that we are simply saying complications of the respiratory system in a preterm baby is another way that could actually be put. So first, as an introduction, we said that fetal lungs don't mature quickly, and when fetal lungs don't mature quickly enough, all right, especially in preterm birth, it can lead to serious breathing difficulties. Of course, we are talking about respiratory system. Okay, so the lungs are among the last organs to develop in a baby. That's why they always say that the baby should reach, 8 months. No, more than 8 months, 9 months, and all. Do you understand? So some of these issues that might come up is what? Respiratory distress syndrome. So there's insufficient surfactant and the lungs are collapsing. Instead of the lungs to stay open for air to come in, the lungs are falling on each other. Bronchopulmonary dysplasia. So chronic lung condition that can develop in very premature infants who require long-term oxygen and ventilation support. Apnea and prematurity. Apnea is more of like you are sleeping, then your throat is falling back. Instead of your throat to stay open for air to be passing through. Do you understand? So, these are all the issues that might come up. Pulmonary hypertension. Okay, so poor lung development can lead to high blood pressure. Okay, increased risk of pneumonia. That's all those infections because your immune system is not even strong. You understand? The meconium aspiration syndrome. This one, the baby could be so stressed that they pass their first stool in the amniotic sac. Do you understand? Amniotic sac being a place where everything is just around it. Okay, the baby might now inhale the stool that it passed out. You understand? So how long maturity is accessed is just the lecithin sphingomyelin ratio and its phosphatidylate. I've already spoken about it. You understand? Then also amniocentesis can be used to test for the presence of the surfactants. Okay, that's supposed to actually keep the lungs patent. So treatment and prevention. So antenatal corticosteroids like beta-metazone. Surfactant therapies is administered after birth. Then you place the baby in neonatal intensive care unit. This will help a lot. Okay, so that's just it for the problems that a baby could face if they are born and their lungs are not matured.